I don't think many more are going to come, so good evening to you all. I got some introductions to make. First of all, we got down the front here is Lee Fribbins. He's the owner of the Racing Pigeon, Secretary of the Confederation, and he's one of the gang of four who represent the Raptor Alliance. And he's also a very successful pigeon flyer. We've also got sitting beside him is the General Manager of the RPRA, hello. Stuart Wardrop. I've been talking to Stuart over the last 2 weeks about our problems, and in fairness they've been very helpful and come to the party as such, and we've made it work. To my right at the end we got Dave Coward-Talbot. Dave has been involved in import-export of pigeons all over the world. He knows a lot of the litigation about bringing pigeons into the country. He's also in Chelmsford, where the animal health office is. He's very friendly with one of the chief animal health officers, who is helping us in trying to get our pigeons reclassified as livestock, so that we could be in a position to protect our pigeons against raptors. So Dave's doing a lot of work on that for us. Immediately to my right is HenK de Weerd. He's a world-renowned pigeon vet. As you know, he's now set up a clinic in the UK in Colchester, and what he's going to do tonight, he's going to bring you up to date with all the current diseases of what's going around, symptoms to look for, and the cures that are available through the veterinary practices. I'll pass you over to Dave because he's going to do the introductions via HenK. Thank you.
Okay, good evening. My job really tonight is just to put a little package together, basically about HenK de Weerd, the clinic in Colchester in Essex, which Lee and myself, along with HenK, have set up. We set this up over a course. It's taken us about 3 or 4 years to get the clinic going, and some of you perhaps have heard of it. We might have even been to the Welsh show that we've been to and seen us represent ourselves there. It's my honour really to talk about the guy on my left, because I think he's the world's leading pigeon vet. He's concentrating totally on pigeons, and with his affection towards the whole pigeon sport, I can phone HenK anywhere, and sometimes I can phone him in China, where he's got clinics in Turkey, Middle East. I can phone HenK wherever and ask him to phone somebody in England or in the UK, and he'll phone them because they've got a problem. He's that sort of guy. So I'm very proud of him to think that I'm associated, and I know Lee feels exactly the same. HenK is here tonight to talk to you principally about problems in pigeons. We're not here to talk about the clinic or our products. He will not discuss that tonight. He's just going to talk to you about the problems that you've got in and around Wales that we've heard of over the last few months. And please feel free to ask questions. If you're not happy about asking questions, put it on a piece of paper or something and send a question up to us. HenK will be quite happy afterwards to handle any situation for you, and any questions you wish to ask, he'll be only too happy to answer. So please feel free on that. We are understanding. We thank Colin very much for the introduction to coming down here. HenK was only too happy to come down. He's a pigeon fancier like all ourselves. I'm a pigeon fancier all my life. My grandfather raced pigeons with a guy called Westcott, which you might remember in Ipswich. My father raced pigeons and I've raced pigeons. So I'm just like you guys. I'm no different to you guys. And the one difficult thing that we've had ever since we've kept pigeons is the fact that we've had to self-administer our medicines. For me, to work with a guy like HenK, I've had to realise how little I know about the medicines of pigeons and the medication of pigeons. And I think this is one of the biggest things that I've had to learn over the last year, 18 months. I knew very little. I grew up actually on a farm as well. I used to use chicken, turkey products and all sorts of things on pigeons, which you've all done. We've all done it. So I hold like I do for myself, it's not our fault that we do not understand medicines. It's nothing to do with us. We'll all have to do it ourselves. Sometimes we've had to start at the beginning of our medicine cabinet, work the way through until we find something that might suit them. It's quite different now. I, for one, have my pigeons' droppings tested 3 or 4 times a year, and if the clinic tells me it's not necessary for me to treat, I do not treat them. So I do not just treat them. One of the main things when HenK came to England was, he said he'd love England to be part of using less antibiotics rather than more. He talks about his own country of Holland and Belgium, over-medication, too much medication, even his best friends. If he says to them, no, I'm not going to treat you, they'll go somewhere else and get the product, so HenK has to look after them. But he would love England and the UK to be far less on the antibiotics front. So I'm like the rest of you, understanding pigeons. There's many people I know out there think they know about pigeons, they think they know about medication, but I can assure you that you don't until you can have a talk to somebody like HenK. So that's my feeling about it all. As I said, Lee and I feel both the same. We're just like all of us. We've had to self-administer. It's a very difficult situation. Pigeon medication is something quite different. The recent problems you've had here, HenK is going to talk to you about in a second. It's probably very much on the Paramyxo. HenK told me a year ago that the Paramyxo virus was becoming much, much stronger, giving a different outlook on what we would perceive as being a Paramyxo, perhaps like the twisted necks, etc. So without further ado, I'm going to ask HenK if he'd give his own introduction and start talking to you about the problems you might have had here recently. HenK de Weerd.
I sit down, right? I keep sitting. Thank you very much for your nice introduction. Dear friends in sport, especially Colin on my left side and Stuart, the officials, the guys who must work for us pigeon fanciers to make everything running and going, etc. And Lee, my partner, and David. It's a pleasure for me to be here in Wales for the first time. Beautiful country. I heard a lot about it and I'm happy to be here. So it's an honor for me to be with you here. Thank you for coming to this event tonight. I'm trying to lead you a little bit in the world of the veterinary practice in racing pigeons. And especially we've come over to tell you something more about Paramyxo, a problem, and a big problem sometimes if you don't vaccinate properly. And now I need to put off my phone, I think. Sorry. Okay, good. Big problem. And the problem is that all of you have seen Paramyxo appearing, coming into the pigeon world. And I saw it happening in Holland we were the first clinic in Holland to see it. It was in 1983. That's nearly 30 years ago. And we have seen the disease changing over the years. And what I always say is we sort of saw 3 kinds of different streams coming. In the beginning it started with some central nervous problems, twisted necks, shaking the head, picking next to the grains and to the food. And when the pigeons still were eating and drinking, when they were left alone and not stressed, the condition stayed very long, not too bad. It was very remarkable, as a matter of fact. And then a year later, well, everybody started to vaccinate at that time, especially and there were no vaccines, and it was difficult in the beginning to make the diagnosis. I remember me sending in those pigeons to labs, state labs in Holland, and it took quite a long time before they found out what it was. And in Germany, it took even longer. Normally Germany is always in the front, but in the pigeon diseases they are not so fast. In Germany, half a year later, that after we found it in Holland, they were thinking that it was still Paramyxo, and they never believed it. But okay, then that came out. It's PPMV. It's a part of the Newcastle disease. So that's the Paramyxo virus number 1. But it's also not, and that's very lucky for us pigeon fanciers, it is not it is Newcastle disease for poultry, but the same virus, but, and that's good, it is the type which is common in pigeons. And this is not very dangerous to poultry, as far as we have found out over the last 30 years. However, the viruses can change a little bit, so we need to be aware of that and be also a little bit concerned about it. So a good vaccination program is very important, not only for our own pigeons, but also for the poultry industry of the UK. We saw the symptoms changing, and we were using, when we found out, and the labs found out that it was a kind of a Newcastle disease type. First they said Paramyxo 3, and then later they said Paramyxo 1. Okay, what's in a name? Huh? I say, what's in a name? Okay, then we start using the white vaccines that were used for poultry, the oily vaccines, the white oily vaccines, and well, that worked. It gave a good immunity, but it also gave problems, because the oil adjuvants sometimes gave granulomas in the neck, and that is knots in the neck, reactions with the subcutis, with the tissue in the neck. And sometimes it was unpredictable. I remember that I was vaccinating a loft of a friend, HenK de Weerd brothers, very famous. They won the first National Barcelona, second international, one time. And I was vaccinating there very carefully and properly in the evening. And all of his birds, let's say 70% of his birds got 1-2 weeks later, especially big knots in the neck. And I did a lot of surgery on those pigeons, but it was terrible. And some other pigeon lofts did not react, or hardly. We saw maybe 4 or 5% of knots, but many times the fanciers did not see the knots and didn't feel the knots. They only vaccinated the birds, and sometimes the birds got an vaccination reaction. They couldn't fly properly. They were a little bit down in condition. They didn't throw down feathers anymore. So then it happened that, and we looked later with an empty crop in those necks, and we found, as we found the last weeks, 3 weeks ago, we were in Newcastle, and there I had also some fanciers, and they said my birds are not doing well, and they look bad, and I couldn't see any sign of a disease. And when I felt the necks, I felt the little knots, and the question was, of course, when did you vaccinate your pigeons? And they said 2-3 weeks ago, and I could absolutely immediately show them and let them feel. They didn't even know the knots in the neck. So the oil vaccines have improved later, after we initially had to use them because there was nothing else on the market. But still, I'm not so crazy for white oily vaccines. I wrote that in 1983, that's about 30 years ago, in the book of my father, that we don't like oil vaccines in pigeons, and we hoped that there would be coming up a spray method, but that has never appeared, like in chickens, because that doesn't work good in pigeons. So now we prefer to use the watery-based vaccines, like Colombovac. However, the problem with the Colombovac is that, and we always use that in Holland, that the stock is, well, the availability, there is never any stock. This is an American company. It has changed many, many times from owner. And the big mergers in the pharmaceutical industry, the guys, the new managers, they look just at the records, they look just at the sales of such vaccines. They say, well, okay, that's peanuts compared to poultry. And so we may make some money. We have also these terrible rules in Europe now. So it costs a lot of money, a lot of time, and the figures are going down, so we stop producing. So at the moment, Pfizer Colombovac is not available. In some countries, yes, other countries not, and not in Holland, not in Belgium, not in Germany. In England, sometimes yes, sometimes no. Changes all the time. So they are not a reliable partner for us, and I heard from the industry that these companies may, in the future, not produce it anymore because the market is just going down and the sales are too small. The same happened with the very good pox vaccine, which we used to use with a little brush, you know, maybe all of you know it. That was the vaccine from Intervet from Holland. A good vaccine, and suddenly they took it from the market. They said, yeah, we have no more place to produce it. Our premises we need for human vaccines, making human vaccines, so they just stopped producing it. So that's a problem. Now we have a big problem on the continent, and also here, I think, with a good pox vaccine. We are helping ourselves with a vaccine which is from Czechia, but that gives rather a big reaction, a very tough reaction on the skin, where we put the virus in the follicles of the feathers. Going back to the Paramyxo story, initially we saw the trembling, the shaking of the head a little bit, later the twisted necks, and then we saw picking next to the grain, of course. About a year later, after everybody had vaccinated and saw that it was a really serious problem, they sometimes forgot, and there it started, their late-head youngsters to vaccinate them. They just forgot it. They thought, okay, everything is vaccinated, no problems, everything is more or less under control. So they forgot to do that. And then we saw other symptoms coming up. That was about a year later, after the first central nervous problems, and we saw massive drinking, loads of water, and massive wet droppings, like watery droppings, like you were about to mop the loft instead of scratching the loft. It was terrible. And this was also a form of Paramyxo, of course, and sometimes, only sometimes, we could see also the central nervous problems, but sometimes coming up after weeks and weeks and weeks. So in the beginning, nobody knew this is Paramyxo. And then we also found sometimes these very strange little feathers that were more or less twisted off, like torn off on the ground, between the wet droppings. That is also very typically, sometimes, in the cases of Paramyxo.
Would you like any present? Lisa, would you like anything on the wall?
Well, I'm not sure. I did bring a presentation which I held at the Olympiad for the FCI in Dortmund. I hope that it's not this, by the way.
It's my kids.
Oh, nice, very nice. And then you can see a little bit. Maybe in the meantime it has changed.
Could you turn the lights down this side, could you please? Thank you.
A little bit.
How's that?
Yeah.
It's okay.
Oh, that's okay, Andy.
Now this is another form. You see, this is another form. This is what we call wobbling on the perch. This was a guy from Belgium who called me and he said, one of my cocks, stock cocks, is behaving strange. He's like wobbling back and forward. And well, I supposed it was Paramyxo. And I had the guy, because he was far away, I said, go to your vet and have it vaccinated. And that wobble pigeon got one vaccination and 3 days later he was okay. So that's also Paramyxo. And of course this is also Paramyxo. There are many different symptoms of Paramyxo, and the problem is that many vets don't know it, and many of you also have never seen it. And the cases we see nowadays, and then I go directly to the fourth stage of the disease, is the sudden death of pigeons at the moment. Not only in Wales and not only in Belgium, but also in Holland. Many young birds not vaccinated, they just drop dead within 24 hours without any signs. And absolutely no signs like this, because here you can see the behavior of the pigeon and strange, this is due to an infection of the brain. And that is, especially in the beginning, the most important symptomatology. So if you have seen this one time, then you think that this is always Paramyxo, and it always looks like this, and that's the problem, and that's the mistake everybody makes, because it looks still the same like this, but not always. We also see symptoms that never get like this. This, for instance, is another symptom of Paramyxo. Everybody would say this is ornithose, because it looks like ornithose if you don't know it. You see the upper eyelid is hanging down a little bit. And in case of ornithose, it looks different. It is a little bit swollen. The conjunctivus, that is the mucous membrane around the eye inside, is swollen a little bit. And the third eyelid, you all know the third eyelid, right? In Belgium they call it vliesje. The third eyelid is sometimes protruding, coming forward. But here you see only the upper eyelid hanging down, and this is a form of Paramyxo. I see this only 1 or 2 times in a year, this form. It's very interesting, and we knew it's Paramyxo because in the loft other pigeons had Paramyxo, and these ones had only a hanging upper eyelid on both sides, many of them, and we did blood tests, serology, and then we found high titers, antibodies in the blood, so this is 100% Paramyxo as well. So maybe we have more images. PPMV, this pigeon Paramyxo virus number 1, still is, well, I see, I hope you can read it. Big lofts. And one loft races, it is a big problem, it's a big threat, but not only in one loft races, also when you're importing pigeons. Groups of young birds that have been together and not been vaccinated, then you easily get an outbreak. It's always when you bring birds together, you have an outbreak. So in one loft, but if you bring in birds from Belgium, what has happened here, then the disease spreads very, very fast. The virus is very contagious, so you see problems immediately. So the virus has changed, and we saw an epidemic in Europe in '83 on the continent, and we saw the tremors of the head, and we saw the twisted necks, and we saw the pecking next to the foot, what I told you. And the pattern 2 was from a year later, '84 onwards, increased water consumption, watery droppings, malformed feathers, and sometimes not really sick, and some flying normally, and mainly late young pigeons. So that's very strange. The birds, they were flying very good, they were training, they didn't look any sick, but they just drink about, 20 birds drank about 2 liters, 3 liters of water, and produce as much water. But they were not sick at all. And this is pattern 3. That is the newer one. And now we have pattern 4, for your information. This is in the present days. It's a little bit combination of 1 and 2. But also we see now droppings turning to slime and green and yellow. We see no vomiting, and we see deaths after 2 to 3 days, 4 or 5 days. The first green droppings, and sometimes in a later stage, you also see the central nervous problems. They are also sometimes apathic behavior, and sometimes when I ask the fanciers, because many diagnoses I need to put on the phone, I need to make my diagnosis on the phone. I'm a little bit trained, over 40 years to do that, so that works pretty good. But the apathic behavior, that is also important, because when I ask them, do they drink a lot of water, sometimes these pigeons cannot find a drinker. They are just too apathic. They just look staring, glazy, and they just cannot find a drink. If you put their mouth in the water, they drink like hell. So you must be careful with the answers you get from the fanciers. And then later they start a little bit trembling and moving. Well, this pattern number 3 I saw for the first time, that must have been about 15 years ago. So around, more than 50 years. So the disease is now apparent since '83, so that's nearly 30 years already, experience with the disease. But this pattern is only from the last 15 years. And the last 4 years, 3-4 years, we see then pattern 4, which I did not yet have ready here when I hold this seminar on the FCI in Dortmund. Pattern 4 is the sudden death, what I told you. So you don't see anything, you just see nothing, they just drop dead, and not a few, because we just got a phone call, and David and Lee and me and Colin were in the other hotel, eating some of your beautiful fish here. We just got a phone call from a guy who had 33 young birds dying in just 1 or 2 days, right? Lee? Right. Drop dead, just drop dead, without any symptoms. So, you need to know that, and my question is always, do they drink a lot of water? And mostly the answer is positive. They drink a lot, but sometimes they don't drink a lot because they are just too sick to find a drinker. So now this is the problem, I think, here. As far as I was involved here in a few cases, young birds coming from Belgium, sitting in a group together, not being vaccinated, And then between your own young birds not being vaccinated, then it spreads like hell. And they have no immunity, and the disease is growing, and the birds can die very, very quick. But not only here, also in Holland, we have the last week's cases like this, also pigeons from Belgium. And they're coming in the lofts, and the people have 2 pigeons and 2 pigeons and 3 pigeons between their own young birds, which are not vaccinated, so they have no immunity at all. And then we see all these sudden death cases coming up, and well, also the vets in Holland, even the pigeon vets. I have about 4 or 5 colleagues in Holland. They also have problems to recognize the disease, because one of them was calling me last Saturday evening and said, "Well, we have so many birds dying suddenly. What do you think?" I said, "Yeah, I know about it, and I'm sure that it's Paramyxo." And then he said, "Yeah, but we got a report from a lab." From a local lab, and he said they found circovirus and adeno. I said, "Yeah, but that you can find that in every pigeon. Every young bird has circovirus, normal, and every bird you can find in many birds adenovirus. And the adenovirus number 1, because you have type 1 and type 2, the type 1 is always a little bit related and associated with adenocoli, with vomiting, completely different disease from this, and not drinking a lot, and no central nervous tremors. Different, but this adenovirus, which triggers a little bit the E. coli, is not harmful, absolutely not. There is an adeno 2, which I have seen only one time, and that was in '91, and that cost about 10,000 pigeons in Holland, in the West. Yellow droppings, dying within 18 hours. That is adeno 2. And that took a long time before the university in Belgium, in Ghent, found that out. Took a long time, and nothing to do against this terrible disease. But luckily for everybody, the disease disappeared. I've never seen it in that way anymore since '91. Okay, let's touch wood. Okay. Can we go on a little bit? Yeah, the diagnosis, for me, because I need to, I cannot be in the whole world at the same time. So a lot of diagnoses I must make just on experience over the phone. And nowadays, with the modern techniques, they can send me emails and pictures and images and small movies, so it's more easy for me. But before that time, it is only just your own experience, what you know. Can you go back 2 times, please? The clinical diagnosis, and the problem is that can you read that? The pathogenicity of the disease varies greatly, and the virulence is host specific. And we have some strains of in poultry. We have so-called lentogenic strains and mesogenic strains and velogenic strains. That means, in normal English, a little bit strong, let us say, a mean virus, and a medium mean virus, and a strong mean virus. That's in poultry, we know that. And the Lesotho strain in poultry is a low pathogenic strain. But in pigeons, nobody knows. But, and also I don't know, but when you look around, you see also the variety, which the 4 patterns, and that has something to do, according to my idea, with also the difference in strains and the difference in immunity of the pigeons. Yeah? The clinical diagnosis and the differential diagnosis. The clinical diagnosis is in the way that you see it, and the vet sees it, and the vet can make the diagnosis according to his experience, or to the story that the fancier tells him. And the differential diagnosis, that is what it can look like other diseases. I mean, so sometimes you don't know. Sometimes you say, okay, I think for 90% or for, let's say, for 60% is this disease, but it could be this, it could be this, could be this, could be this. And then you start to eradicate this and this and this, and then you have probably the most chance that you have the right diagnosis. So observation for the fancier or for me, and listening to the fancier, and the questions. When have your pigeons been vaccinated? Are the pigeons drinking a lot of water? Are they vomiting or not? How is the morbidity? Morbidity means in one night I get 50% pigeons sick all at once. Or I have in one night only 3 pigeons sick at once. That's morbidity. Is there incoordination? Are there tremors? Are there central nervous problems? And are the birds dying? So that are my questions. And that is important to know which kind of a disease is. But the first question is, of course, what age? It's not there. But the first question always, have they been vaccinated for Paramyxo? Yeah? And can they be cured? Well, the quicker the diagnosis is made, the higher probability of recovery without problems. We have found out, and if you look at all the leaflets of the vaccines, all the producers say, don't vaccinate pigeons that are not healthy. But I found out that if you have Paramyxo, that the only way to treat them, and with a chance of to let survive 50%, the only chance you get is to vaccinate them immediately. So, and I always say, don't tell your vet that they are sick or they have Paramyxo. Most vets don't even see it. But if you tell a vet the birds are sick or they have Paramyxo, they say, oh, well, yeah, no, don't vaccinate them. But the only chance you get if you vaccinate them. And if you are quick, and not after 2-3 weeks, because then it's over, but if you do it immediately and the whole loft, then you have a very good chance that many birds survive. Many survive. Right? So it's really very important. And there is also emergency vaccination in pigeons, and that is what we especially use in youngsters in the nest. Also, young birds in the nest may have Paramyxo, and they get it from the old birds. The old birds are vaccinated most of the time, on time, but sometimes a little bit late, and sometimes they can bring in the virus on their feathers through contact with other pigeons, and they can give it to the youngsters. And then the youngsters will die, may die from about 3-4 days old until they are weaning, because then they are youngsters. When they're weaned, they're still youngsters, but then they can also die after weaning. But I mean, in the nest, and they leave the nest at 4 weeks, you know, so they may die at 3-4 days until weaning. And we see also sudden deaths, and we see also birds twisting in the nest. And then this story of the differential diagnosis turns up, because in that case, sometimes dying young birds in the nest at the age of coming into the feathers, 10-14 days. Then also you must think of Salmonella paratyphoid. So that's always difficult for me to find out what is really the matter. But Salmonella never has such a high morbidity. Salmonella is always on a lower degree, only 1 or 2. And many times when you have that, you have also a history of eggs that did not hatch, or dying youngsters in the egg. Or you have story of old birds. One has a swollen joint on the wing, one is crippled. That's also always the story a little bit in case of Salmonella. So if we have many youngsters dying in the nest, and sometimes laying upside down, and sometimes a twisted neck, and you have more than 1 or 2 or 3, then it is also never Salmonella, but it's also Paramyxo. And in those cases, we use the emergency vaccination with the Lasota drip method, because this gives an immediate kind of immunity. And I have had not many cases in the nest, maybe only 4 or 5 per year. And we found out that if we do immediately the vaccination, that the mortality stops. So that's also a good way to help the birds.
Can you make it clear, HenK, that Lesotho is not licensed in this country?
Okay, yeah, if it's not licensed, then it's over. Then we cannot use it. That's a pity, because that's the only way to help your birds. You cannot vaccinate pigeons from 2-3 days old. You cannot with a needle. Besides, it takes a long time before you build up immunity, at least a week. So the drip method is a good method, and we use that regularly. But I did never know that Lasota is not... the chicken Lasota is also not available?
License for pigeons.
Yeah, but that's another story, of course. Sometimes I drive through a red light, but it's not allowed. But
It's on our agenda.
okay, but I advise you strongly to do it. because otherwise you lose a lot of young birds, and this can really save your young birds. So don't say anything, and 4 drops, very easy, 4 drops, and we use, and don't be surprised, we have for 1,000 chickens the dose, and we use it for, we make it for 100 pigeons. We make it 10 times stronger, and we can even administer to young pigeons in the nest who just open their eyes, so 2 days old, and they get 10 times stronger than a chicken vaccine without any problem, without any problem. 4 drops.
They'll all be ringing you tomorrow.
4 drops. So because they have 2 nostrils and 2 eyes, so that makes 4 drops, and it works pretty good, pretty good. I must really say it works pretty good. And what else can we do? Yeah, we cannot do a lot of things. We can help them a little bit with electrolytes if they drink a lot of water. We need to substitute a little bit the lost fluid from the body. It's not only coming from the out of the intestines, it's also coming through the kidneys a little bit. So you cannot see quite well if it's only water out of the droppings or also a little bit urine. It's a combination, I think. Nobody knows, but I think so. So electrolytes may help a little bit, and sometimes we also advise to use some antibiotics just to cut any complicating bacterial infection which might be coming up. So it is also harmless to give a light antibiotic treatment for about 5-6 days with some electrolytes together with the vaccination, but the vaccination is the most important thing. Yep. Well, yeah. As you see, the PPM, and we call it PPMV, and we have a reason to call it PPMV because all the authorities are very careful and very concerned about the poultry all over Europe. And so if we say Newcastle disease, they all get crazy and mad. So we say Paramyxo, and then we invented the word PPMV in the board of the FCI, the veterinary committee. PPMV, pigeon Paramyxo virus number 1. So that clearly states that it's different from the chicken virus, from the poultry virus, from the Newcastle disease. And it is absolutely true that it's different because it's, so far as I know, I've never seen it attacking poultry. I never heard stories about, and we saw many outbreaks of Paramyxo, many outbreaks. But I've never seen them being aggressive to poultry, and it stands there. It's mainly pathogenic for pigeons, not for poultry, and it poses no threat to the poultry industry. No, let's hope so. Touch wood again. We hope the virus doesn't change. But so far we have seen any problems. However, in England there was a famous virologist, Professor Alexander. Maybe you heard about him. And he was very concerned, but I also found out that the older scientists sometimes are not really knowing what's going on in the field anymore. They stay in their ivory tower and have sometimes not a lot of contact with the field. And we are standing in the field. I'm not in the lab, I'm in the field, so I see what's happening in the field. And in the field we see the things first, and later in the lab they are confirmed or not confirmed. So. Then the prevention. So vaccination, of course, it's the only way to control the PPMV number 1. Don't use La Sota, only as an emergency vaccination in young birds when they are dying in the nest, and then it's a must, up to me, it's a must, it's the only way. But don't use them in old birds normally because it gives a short, immediate immunity, a local immunity. It doesn't give any titers in the blood, so in the blood, in the serology you will never see it. It gives a local immunity in the eyes and in the nose, which is important because there through many times comes the infection. And it works very short. It works the first time maybe 3 weeks. You need to repeat it. That's what we did also in '83, because when we had no vaccine in '83, we also used La Sota. So, but just for your information, don't use it, but we used it in '83. First time 3 weeks, second time 6 weeks, and then it worked. Many people still use it. However, there are a lot of breakthroughs, and I would never advise it, but people like to do it because in our countries the vet needs to vaccinate. Sometimes they are very expensive, so the people are looking for other ways to use a vaccine. And it's lucky that here in the UK you can do it by yourself, controlled a little bit by your organization. I think that's the best way, because many vets are not able to vaccinate properly. They never do it. They put the needle somewhere in the pigeon. It's terrible to see. Sometimes the pigeons are dying on the needle and they say, "Yeah, sorry, the bird is allergic," but the vet is allergic because he doesn't know how to vaccinate. He's just putting it on the wrong place, somewhere in a vein or something in a nerve, and the bird is laying and dying. I've seen that happening many times. So, well, there are not too many vets who are used to vaccinating pigeons. We use inactivated vaccines in Europe, and we must also vaccinate all our pigeons, and not say only the ones that are racing, because the breeders, okay, they are maybe less susceptible because they have less contact with the virus, but breeders also, if you don't vaccinate them and they have no more contact with the field virus, they lose their immunity after the first vaccination, and they have a very low immunity level, and when then they have contact for some reason with the virus, you get an outbreak. And I know this so well because it happened to me. All the shit happened to me, and that happened about 15 years ago with my breeders. In the beginning we thought, okay, we vaccinate them 2 times. Yearlings, young birds are yearlings. That should give a lifelong immunity, we thought. We didn't know, but that's long ago. I'm talking about 15, 20 years ago. But then my old birds, breeders start to drop dead, and good ones. All my Janardas, a lot of them, choop dead. So then we found out that was Paramyxo, and so don't rely on 1 or 2 vaccinations. If you have good breeders and you love your breeders and you build up a strain, please vaccinate them every year, because don't take the risk that they get the disease. Because I have had fanciers, your colleagues, in my clinic, crying as a child because they lose all their whole strain of long-distance pigeons. They thought, okay, long-distance birds, very strong pigeons, very strong. Nature pigeons, they don't need anything anymore. 1-time vaccination, okay. And then they got an outbreak, they didn't know, it looked different. And then of course we saw this Paramyxo, and they were already too late. They never come in the beginning, they wait, and then it's going on for 3-4 weeks, and then we can do a lot of things. So they lose their strain that has been built up maybe by 20 years of hard work and hard selection. So that happens. So do that. Vaccinate also the birds you're not racing with. This is the cock again who's wobbling, I think. The so-called wobbling cock. Or not. This seems to be a normal cock, yeah. We had the wobbler already. Yeah. Okay. Prevention through... huh? Oh, no, that was the cock after the vaccination. Sorry. Yeah. So I advised the guy, give him the vaccination, and I said, try to make a little film and send a film to me. And he did that. He did it before. I let him vaccinate it, and 3 days after, it was completely normal. That happened also with pigeons that are coming to my clinic laying on the back, just a little bit flattering, you say, with the wings. And then, yeah, what else can it be than Paramyxo if the rest looks good? So vaccinate the bird for Paramyxo. 2 days later, completely normal. Birds sitting in a cage, just staring, not eat, not drink, going down in condition. And I look at the pigeon, I think, he looks so strange, must be apathic. That can only be Paramyxo, because I don't know anything better. So, vaccination, 2 days later, normal. So, many strange things. And when do you need to vaccinate? Well, you can vaccinate the pigeon at almost any time. But you cannot vaccinate them. I would rather tell you when you should not vaccinate them. You should not vaccinate them shortly before you race, and shortly before you mate them up, you pair them, because then you may have problems with the condition and with laying, and short before the race, of course, you shouldn't do that, because again, when the condition goes down, especially when you vaccinate with white, milky, oily vaccines, then you may have some problems in a few percentage of your pigeons. In Newcastle, we found then when we were aware of it, we found a number of birds, and also in Breda, in the clinic, we find many times. But many times we don't look for it, but I learned, I'm teaching young vets from all over the world, sometimes from Poland, sometimes from China. And I also teach them all the time to feel with an empty crop in the neck a few weeks after the vaccination, just to be sure that they have no knots and that the lack of condition is not due to a knot in the neck. So vaccinate. I advise them to vaccinate them at 4 or 5 weeks when they're weaned, because why you should wait longer? If you wait 2 months longer, you have 2 months the chance that they get infected with Paramyxo, so don't take that chance. So vaccinate them at 4 or 5 weeks when they go from the nest. And the old birds should be vaccinated every year. It's 3 to 4 weeks prior to breeding and prior to racing as well. And parental immunity, I also believe strongly that that not only there will be immunity going through the egg, but also both the parents, they feed crop milk, and I think that both the crop milk has some gamma globulins and some special immunity, let's say, immunity levels that the young birds get some parental immunity, which normally it is maternal, from the immunity by drinking milk, of course, from the mother, because the mother produces milk. So you have this colostrum in cows, but in old birds, in pigeons, I mean, both the parents produce crop milk, so they get it here from both the parents, so it's parental, yeah? Okay, and then we had a scheme made for the one-loft races, but that's not so important for you, I think. So I only can say, if you buy pigeons somewhere, be very careful and don't put them between your own youngsters. Put them apart, put them in your own quarantine if you can for 2 weeks, at least 2 weeks. Better 3 weeks, but the problem is, and that is something I did not yet talk with you about, is that the incubation period, and that's the period, the incubation time is the time that goes between the picking up the infection, infected today, and then it may take up to 6 weeks. That's the end of the table, 6 weeks, where David sits. It's 6 weeks, David. It may take 6 weeks before the disease comes out here, infected here. But sometimes it takes 1 week, sometimes 2, 3, 4, 5. But I found out by experience that you vaccinate the pigeons and that it can take 6 weeks and no longer than 6 weeks, that sometimes you see an outbreak after 6 weeks. And not after 7 weeks, after 6 weeks. Mostly after 1 week, 2 weeks, 3 weeks, because you are vaccinating in this period. If you vaccinate in this period, the disease comes out anyway. Here, or here, or here, or here, and also here. But if you vaccinate here, this period gets longer, so it can come out here. So just for your understanding, to make it easy. And that's the reason that many of you, and also in the one lofts, don't understand that your birds get an outbreak of Paramyxo, because you all believe, I vaccinate my pigeons. So how is it possible they get Paramyxo 3 weeks later, or 4 weeks later? Because of this long incubation period. And the funny thing is that once the outbreak is there, if you then vaccinate your pigeons, it works for many of them as a therapy. But in this period, you can do nothing. It just comes out. And when it comes out, you need to vaccinate them just to save what you can save. The sooner the better. If you wait 5 weeks with an outbreak, all the birds will die. If you see an outbreak the very beginning, you vaccinate, you can save a lot of pigeons. A lot of pigeons. A lot of pigeons. So, yeah, well, I think, do we have anything else in the computer? Thank you very much for your attention. Well, that's for later. That's for later. So, about Paramyxo, do you have any questions? Some things clear, not clear?
Yes. You always do it in the neck, do you? Because
Yeah.
the American guy on that video I watched, and he was doing it in the leg.
doing it by himself.
Yeah, yeah, yeah.
Doing it in the armpit sort of thing.
Yeah, to my opinion, you should never do it by yourself, because I wouldn't even do it by myself, because you never know where your needle is going if you put the pigeon on your arm or between your legs. Some people put the pigeon between their legs and they vaccinate them. But do it properly. Do it low in the neck. Do it with the needle oblique to the backwards. Pull up a few feathers, that you have a fold a little bit, and like a fold here. And if this is the head of the pigeon here, and this is the fold, put the needle backwards, and here you have the wings. Put the needle backwards a little bit. Put the needle 1 or 2 millimeters inside the fold, and never vaccinate with a full crop of food, because many times you have no subcutis, you have no tissue, so you're injecting in the crop, and then also you have no effect from your vaccination, and besides you can get a leaking crop, which also gives problems. So do it always not in the leg and not in the muscle, always do it low in the neck and not high in the neck, and always with the needle to the backward side. And I have vaccinated hundreds of thousands of birds. I've never had one pigeon with dying or allergic, never. But you must not do it like many vets. I see it, they are in a hurry, they use an old needle, they just bang, 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 bang. They don't even look where they vaccinate, and then you get problems. And sometimes pigeons are dying. That happens regularly. Okay? Any more? So you vaccinate on time for Paramyxo? Paramyxo, right?
Paramyxo, and then 6 weeks after, I gave them half dose.
Yeah, okay.
And had no problems.
Yeah, that's
Half a dose you gave.
that's nice. Yeah, well, yeah, I wish there was a connection, because then all the people that vaccinated their pigeons for the first time, and 6 weeks later half dose for the second time, but then we talk about 6 weeks already. That would be great, and I think it may work under your circumstances for some reason. Sometimes you never know why things happen or not happen. But many people also know that after the vaccination, many times after vaccination, you get an outbreak of Paramyxo. Of adeno, because we were talking about adeno, right? You were talking about, what you mentioned is vomiting young birds, sick young birds. That is no Paramyxo, that is adeno coli, yeah? That's no Paramyxo, that's adeno. So you were mentioning that if I vaccinate for Paramyxo 2 times, the 6 weeks in between, you have less problems with adeno coli. Yeah, but I wish that was true for everybody, but that can be the case in your situation. But normally we hear that many people say, I'm afraid to vaccinate my young birds because I find every year that shortly after the vaccination for Paramyxo, they get adeno coli. The 2 things have nothing to do with it, a little bit, because we think that from the vaccination they get a little bit stress, and due to the stress they get adeno. We know that young birds get adeno coli from stress. When we start training a lot in the baskets, we let them out, then adeno comes. When we start using the darkening system, many times we know adeno coli is coming. So that is the reason that I advise many people also not to vaccinate in an early stage for Paramyxo, because a lot of pigeons get adeno after the Paramyxo vaccination due to the stress. It's better to do it as early as possible, not only to avoid Paramyxo, but also to avoid this going down in condition, this adeno coli, later in the season, where you're close to the beginning of the race season for the young birds, for that reason. And that you have this good experience, that's very nice, and keep doing like that, but I cannot tell that it's a general rule. I wish it was, but I cannot say that. But thank you for the... Yeah, no. Well, I wish I could say, that would be very nice, but no. Many people say when they vaccinate for Paramyxo, some days later we get some problems with with droppings from the birds and the vomiting. Also not as a rule, but it just happens. If I put everything on a weight scale, I see more problems with adeno after vaccination. And not only a Paramyxo vaccination, also after Salmonella vaccination or a pox vaccination. Just handling the birds, the stress is already a factor for a small outbreak of adeno coli. However, the adeno coli has got lower in virulence than before. It has also changed in the last 25, 30 years, because that is also a disease we know 30 years. And that, in the beginning, the morbidity was very high, 40, 50% in one night in the loft, with also pigeons dying quickly, adeno coli. But now we see far less pigeons infected, only a few, 3, 4, 5, getting skinny, crops full of water, not drinking a lot, but crops full of water, and which just don't digest, green droppings, adeno coli. But we can cure a lot of those pigeons. We can cure now, and before that was more difficult. So that has also changed. Yeah.
What do you recommend for after we inject them? Then is there anything that we can give them to try and?
Well, if you find out that you have always problems with after the vaccination, that your birds go down and they get a kind of E. coli infection, is it adeno coli or just E. coli, a little bit vomiting, then you should give them some antibiotic just to help them, because that is we can treat. Adeno coli is a bacterial disease. It's not the adeno so much, it's adeno 1, a little bit, which we found in an early stage, maybe let us say in the beginning of the 80s, the end of the 70s, we saw the problem coming up earlier than the Paramyxo, much earlier. And it was adeno 1 virus they found in Belgium. My colleague Le Mailleux, a very famous good doctor, good friend also, Paul Le Mailleux, and he found in his team at the university in Ghent, they found an adeno 1 virus, which was on its own not not dangerous at all, but just made them a little bit watery droppings. Later, it triggered the E. coli. E. coli, we have maybe 100 strains of E. coli. The problem with E. coli is that it is facultative pathogenic. That means today it's okay and tomorrow it's pathogenic. You never know. It can turn and twist and do and change a little bit suddenly, so that's a problem. And all these different strains, which we simple vets cannot make the difference. Only special institutes for human research know the E. coli, you know, is also in humans a big problem, sometimes E. coli. E. coli is a problem that you many times easily nowadays can treat with a good antibiotic. There is a lot of argue internationally in the press and in the vets and the pigeon vets about yes or no Salmonella vaccination. And then my question to you, is there any arguing, any discussion about vaccinating Paramyxo? No. So that means Paramyxo is very effective and a very good vaccination, and paratyphoid. The simple fact that everybody talks about it means that it is not a fantastic vaccination. Some people do it and say, well, it's okay, I keep doing it. Other people say, I did it, I never do it again. I can tell you one thing, if I vaccinate 1,000 pigeons with Coca-Cola, 0.2 in the neck, from this 1,000 pigeons, maybe 2 get Salmonella. Huh? So and the other 998, they don't get Salmonella. So, and now many people say, okay, fantastic, it works against Salmonella. But that's not true. Think it over, think it over.
What about the Jack Daniels in there?
Jack Daniels is fantastic. I never have Salmonella. I have nothing against Salmonella vaccination, but I only want to tell you, don't sleep on 2 ears if you vaccinate for Salmonella, because I've seen so many outbreaks after the vaccination. And especially I see this in fancy pigeons, show pigeons, because our pigeons, our race pigeons, are very strong. They have been selected many generations, many years on natural resistance, on immunity, on power. We have fantastic birds, fantastic. I have written an article about 1976, I think, that's long ago as well. And in 40 years' time, Salmonella situation, nothing has changed. The diagnosis is still as difficult as 40 years ago. And the clinical diagnosis, just by experience, just the phone call, 5 questions. 90% I know Salmonella, yes or no. In the blood, it's difficult. In the droppings, difficult. Because many times the pigeons have Salmonella and you cannot find it in the droppings. Sometimes you find it routine, Salmonella in the droppings, and the birds are not sick, they fly like hell. That happens also. The vaccines for Salmonella are as bad as 40 years ago. The treatment for Salmonella is as difficult as 40 years ago. At that time we have NFZ, furatodone, furazolidone, chlorphenicol, all these things. They are more or less outcast now a little bit because people are afraid they come into the food-producing animals, you know it. So that gives us, and those are good medications, however they are still on the market, of course, even legally. And the newer ones like Baytril and trimethoprim, they are not better than the old ones. So, but it's always a problem. Salmonella is difficult. And you know, because in Holland and in Belgium and in Germany, if you buy in the supermarket a piece of chicken breast or something like that, you never know. Eh? They always say don't eat it raw, always cook it or bake it or cook it or grill it through, completely, done, well done. Because we cannot guarantee one piece is free of Salmonella. That's the situation, it's true. Not that you get very sick if you eat Salmonella from a chicken, but older people with a low immunity level, a general immunity level, they can get sick. You see that in people where people live.
Especially young children.
Yes, but especially elderly children living in an elderly house, a house for elderly people. Sometimes they eat some mayonnaise or they eat some ice cream or something that has been infected with Salmonella and they get an outbreak and you may die, you may dehydrate and may die. So it's always a little bit difficult. The good thing is that from our pigeon Salmonella, which is the Salmonella belonging to the B group, and it's always Salmonella typhimurium, which means typhi is typhus and murium is mouse, so from the mouse typhus. And it's always the variety Copenhagen. So it's Salmonella typhimurium variety Copenhagen. Always the same in pigeons. And this type of Salmonella is absolutely not dangerous for us. Absolutely not. So no problem. Many people ask me, many doctors call me from hospitals about pigeon diseases, etc., etc. But this is really not a problem. Absolutely not.
Anything else?
Else? What else? Of course, this is individual.
You can give any suggestions to help the ones that are not, you know,
But,
you're still with me?
yeah, but I have always a lot of questions. But I spoke with Graham Smith about the problems here about a few weeks ago, and I told him that it's all Paramyxo here, and that it was confirmed after 2 weeks later. They found it, but it took them 2 weeks. So, but we knew it already because of experience, of course. But such an individual case, I cannot say that it's Paramyxo. Then I have a question: is it an old bird or a young bird? Was it an old pigeon or a young pigeon?
A February hatched.
Freshly hatched.
February.
I'm sorry.
15th of February.
Okay, a young bird.
Younger.
And the young birds were sitting in a loft together with many other young birds?
Yes.
And it's the only one that died?
It's the only one that's dead, but there's watery patches.
Watery.
Watery patches on
And had it vomited or not?
No.
Well, that may be Paramyxo, but it may also not be Paramyxo, because if it's only one pigeon, I don't think it's Paramyxo.
The others don't look terribly happy.
Huh? Sorry?
The others don't look terribly happy.
Okay.
Yeah, this might be
And when have they been vaccinated? Oh. Here we go. But if it's Paramyxo, it's not logic, because in the case of Paramyxo, you have really an outbreak. You have not only one case. So it may come up now in the next week. If nothing happens in the next week, then it's not Paramyxo. I don't believe it. Unless it's a pigeon that you bought from another loft. No, that is not. However, my advice is vaccinate immediately the other pigeons. And if then you get, after 4 or 5 days, massive wet droppings and massive drinking, then we were in this period. Yeah, then we were in the red area with the vaccination. Then it was Paramyxo. If there is an out... Huh? Yeah, but he cannot know that, and I cannot know that, because I need to see a blood serology test. So I don't know. And he don't know. And we cannot know. It's impossible to know. Only with the situation, and the situation now depends on what's going to happen the next week. That's the situation. If you vaccinate your pigeons tomorrow, after tomorrow, and you get a reaction with drinking a lot, then it was Paramyxo. If nothing happens, I don't believe this pigeon was Paramyxo, because there are also many other reasons why one pigeon can die. Yeah.
Right. Do you want to have a 5-minute break so you can top up and then we'll continue?
I think it's a serious matter now, the Paramyxo injection and the control of it. And I think that we can all get a bit lax as pigeon fanciers. And I think HenK's given you a comprehensive outlay of what it means and what it doesn't mean. I've spoken to HenK on many occasions about antibiotics. And I've said to him, because there's always a conception, is that while you're treating with antibiotics, you know, you can overdo it, you can do too much. But I said to him once, if I'm treating my pigeons with antibiotics, you know, is it wrong? Are they getting better training? And he said, no, you're treating with antibiotics, you're making them better. And this sometimes is a misconception. If your pigeons are ill, you do need to treat them. And this is one of these situations. As far as the import and export of pigeons, which I've been involved with for a great number of years now, Lee and I were with a ministry man only last week, and he was under the understanding that any pigeons brought back into the country were being controlled, what I call a barley certificate holder. I don't know if any of you hold one of those or know anybody that holds one of those, but he was under the misconception, as it was, that this is how imports were being run. Of course, most of you can go to Belgium and Holland, pick your pigeons up and come straight back with them, as long as maybe you have a vet certificate. But even that, sometimes bringing pigeons back across the border is not necessary. So it's quite open. I mean, as far as the EU is concerned, I'm a barley certificate holder, and I can send pigeons anywhere in Europe with my signature and the paperwork that I require as a barley certificate holder. Anything outside of the European common market is much more difficult. Much, much more difficult. Like China, America, Australia is the hardest place, and that's very, very difficult at the moment. Anyway, it's as much as I'm going to say. If anybody wants any more information on that afterwards, you've got HenK here to have a chat with. This is the most important thing. While he's here, talk to HenK. I don't know if HenK wants to pick up on anything else, particularly other diseases, other problems you might have, but he's here for you, and I'd make great use of him if I were you guys. So it's over the phone. Anybody got any questions?
Yeah, but I've followed the virus now since 1983. That's almost 40 years. And it has changed, yes, but not dramatically, And we still can control it very, very good with our annual vaccination on time and knowing the situation. With the incubation time, 6 weeks, which many people of us don't know, very important to know. Otherwise, you think, I vaccinate, how is it possible that 4 weeks later I have an outbreak? If you know that the incubation period can be up to 6 weeks, then you understand it much better and you know its logic. So I'm not so afraid of you after 40 years following this virus, so don't worry too much, don't worry. And also in poultry, we know these viruses, and they come up, and there are many, many field viruses, the so-called lantogenic strains, many of them. I don't think we need to be very much afraid. Also, when we follow the poultry situation, I really, from my experience, I don't think you need to. I share that concern with you. Don't be afraid. Don't be afraid of that. Okay. Deep litter. Deep litter is well, that when we do dropping tests and we find a lot of coccidiosis and a lot of worms, then my first question is, what do you have on the ground? First question. And many times in the past they have an open aviary with a ground floor, I mean with just earth, ground. And of course that is a gathering situation, because if you have one pigeon who excretes coccidiosis or worms, you have loads of eggs, and not 10 eggs, but thousands, hundreds of thousands of eggs. And when a pigeon eats one egg, one oocyst from cocci or one egg of a worm, he has no problem. But if he eats maybe 100, he gets an infection. So if I find a lot of cocci and worms, most of the time, the question I immediately ask, what do you have on the ground, is not only deep litter, but sometimes straw, and sometimes even those so-called cat grit, you know, cat grit, or the grit for, especially for pigeons, the so-called anti-coccidiosis sometimes provokes coccidiosis. It's dry, and we have all learned that it's important. We have all learned that the eggs will develop in a humid atmosphere, warm and humid atmosphere. However, even if it's dry, the eggs may not develop so fast, but if you pick them up, they will develop in the pigeon's body. So it's not a coincidence that my first question is, what do you have on the ground? So deep litter is hay, straw. Straw is very nice in a loft. It covers the bottom. It is a kind of isolation, very important, warm. So it's nice, but once you have an infection, it's a disaster. You need to kick everything out, treat the pigeons, and then you can bring it back. But you must be aware, if you have deep litter, have your droppings checked regularly. And don't think always what you think, that if your birds have coccidiosis or worms, that always the droppings are bad. Some people ask me, can you see on the droppings what kind of disease your pigeons have? And these are old misunderstandings. They say, watery droppings with a little sausage in it, so small, that's cocci. And droppings a little bit slimy and a little bit yellow, that's worms. Absolutely not true. Absolutely not. Every day I see pigeons with normal droppings, completely normal droppings, perfect droppings, who have hairworms inside, coccidiosis, ascaridia. So it doesn't mean anything. Because pigeons who have a disease like worms in their intestines for a longer time, the body adapts a little bit, starts producing a kind of immunity. In the beginning they may have bad droppings, but on the longer run the droppings turn normal again. Unless the infection is so big and heavy, of course, that the birds get skinny and sick. But many times you cannot see it. You cannot see it.
I thought the immune system would have felt that.
Yeah. Yeah.
Through.
Yeah.
Because in my young bird loft, I never clean out until racing comes. So that means I got dry droppings in the loft all the time.
But it doesn't mean anything, because if you check those droppings, sometimes,
Yeah.
I did that on one loft in China a lot of times, because the Eierkamp one loft race in Peking, where you can make, they give, well, it costs a lot of money to enter a pigeon, 800 pounds around, but they also give out £1 million. 1 million. So the first prize is £200,000. And those birds are not on litter, they are on grills, wooden grills, high. But in those pigeons, I found regularly coccidiosis. Unbelievable, yeah. So, but they start with 8,000 pigeons. But the length of the loft is 120 meters. And there are many accidents in the sky. When all these birds fly out, they have collisions in the sky, and one of the two drops dead, or two of them drop dead. Most crazy things happen there. So you cannot always say on the droppings that your pigeons, it looks like your pigeons are perfect, and they will be most of the time. But also we find sometimes coccidiosis in perfect normal droppings. And even the birds can have a rather good condition, but it should not be there. And if you send droppings to your lab, to your vet, always bring droppings that are representative for your loft. If you have 20 birds in a loft, don't take 3 drops of droppings. Take some good droppings, some bad droppings. Mix them together from 2 days, mix them very good and send them to your vet. And sometimes you hear the people doing that and they say, well, I sent droppings to 3 vets and they come up with 3 different diagnoses. How is that possible? And the only answer is 2 possibilities. Or the vets are not good, but or your sample was not good. So what you need to do is mix the droppings from your loft, from 2 days together, and mix it very, very good. Then you take from this mixture 3 pieces, 3 parts, and then you send it to 3 vets. And if the vets are okay, they should all find the same thing, the same diagnosis. But you cannot bring this to one vet and this to another vet, because they will find different things. You understand? Okay. So, deep litter, okay?
Yeah.
But
Back to the room.
nevertheless, check your droppings a little bit from time to time, just to make sure. Because once you have an infection in deep litter, it's terrible. You know, it's coming back all the time, all the time. Yeah, 60 days is the period that you're not allowed to raise your pigeons, right?
Would he be?
Yeah, I think that's...
Would he be really clear of the Paramyxo
Well,
60 days or?
Are they clear?
Well, the problem is a little bit that even a healthy pigeon with a good immunity status, even a healthy pigeon, theoretically can carry the virus on its wings and bring it to other pigeons. But that chance is not too big. Not too big. That could happen with an old bird infecting his youngster when the old bird has a good immunity but had contact with a sick pigeon. And then these stories we have also done in the cases of avian flu. And in the cases of avian flu, we also had some research from important virologists in Germany. And this lady found that the chances were very, very little that the pigeons could carry it on their wings, or even with the droppings from coming back from a race to infect the other pigeons. She thought that their chance is very small. So I believe that is a small chance. I also believe that 60 days is rather a long period. And also we know that and that is for all the diseases, in the beginning, at the very beginning, they produce most of the viruses, and the viruses are at their highest levels to be also excreted. So when I have a pigeon that had Paramyxo and I vaccinate that pigeon, and it has still symptoms, of course. It may have symptoms for 2-3 months, and it may have wet droppings, but we found out that such pigeons after 2 months don't excrete the virus anymore. They have the symptoms, they have damages in the brain, but it's like an old injury. I mean, they are no more contagious to other pigeons after a few weeks. That's what we believe. The chances, and the longer in the time, the less chance there is that they can bring the virus to another pigeon. In the very beginning, of course they are. If you have sick pigeons together in a loft, many sick pigeons, there is a high virulence of the disease, and the disease spreads easily. If you put those pigeons, a few of them, in a loft of healthy pigeons, then there will be an outbreak immediately. But if these sick pigeons have been going on in a loft, sitting there for 3 months, well, it's still dangerous, but most of the time that doesn't happen because you will kill the birds. So, generally spoken, after 60 days is rather a long period. I would not be afraid of Paramyxo after, let us say, about 2 months. I would not be afraid. Huh?
Can I say 60 days is what's imposed by Death for Animal Health? It's not what anybody else imposes.
Yeah. But the authorities, the ministry, of course, they need to take the good odds, and they must build in all the security they can. So they take a rather long period, and then 3 months is for me rather a long period. But they want to make sure that the chances are very, very low for further infection. So I can understand that they say 3 months, and I would say 2 months, something like that. Yeah.
Can I just say one thing about your union? We've spoken about this on the way up, and we praise your union for closing you down for at least a week to try and find out your problems. I understand 1 or 2 people were not happy about being closed down, but let's be honest, gentlemen, all of you and ladies amongst you here, I'm sure you wouldn't want infected pigeons going on that transport. You've already heard today how infectious this disease is. And I'm sure your union took a very good decision on stopping and at least trying to sort out the problem before you proceeded. So I'd just like to add that.
Yeah, I agree. That's correct. As long as you don't know what's going on, you don't want to bring in an unknown disease which spreads like hell and kicks you all out of the sport. So I think the organization has no other choice to do that. They do that with pain in the heart, but they need to, unless they find out.
Does this happen though every year?
Sorry?
Is this going to happen every year? That
No,
somebody brings
no.
in birds and
Well, it's
they
up-
have an outbreak,
it's
and
up
all
to-
of a sudden we stop flying again.
It's up to you a little bit. Now you know the situation. All of you who are here and who read the articles and notice the situation, it's up to you. If you bring in birds and you take measures, keep a little bit quarantine, no problem. No problem.
Well, I think everybody after the last week or so has been made aware of what's gone on, and I think from now on everybody who goes abroad and brings birds back understands that there is a risk, and they will look at that risk when they put the birds in their loft. I mean, people have got to do it if they continue to buy birds abroad, but the big thing about it all is if you vaccinate the pigeons that are in your loft, then the rest of the pigeons in your loft are not going to catch it. It's only going to be the birds that you put in there. I mean, one of the problems is that birds within the lofts were not vaccinated anyway, which means they've transferred into the older pigeons in the loft.
Yeah, well, that's all right, Paul, but at the end of the day, if this is going to happen every year, that somebody gets the disease, right, I vaccinated, other people vaccinated, so we're not going to worry about that really, but still we're getting stopped from flying.
Well, you know, somebody had to make a decision at the end of the
Wrong
day.
decision, don't get me wrong, but what I'm trying to say is, if this is going to happen every year, that something outbreak occurs in somebody's loft because they brought pigeons into this country, and we are going to suffer, although we have already injected.
The problem is, the problem is, John, that we do not have control over what pigeons are imported into this country. The law of the land is that these people can import these pigeons. The European law is the same. I took advice from our union solicitors regarding the import of pigeons and the way they've been brought in. And basically under the law there is nothing we can do as a union. We cannot control what people do outside of the union in going overseas and buying pigeons.
No, I'm not saying that. But we could do it then as a union, that we could, these people that do bring them in without having everything in order and they have an outbreak, there's something that we could do about it.
We cannot.
So that means that we could have this problem every year then.
The point I was going to make was, you were talking about Paramyxo. What about if it wasn't Paramyxo?
Yeah, well that's it, that's fair enough.
Yeah.
No, I'm not saying that we done wrong, that
No.
the union done wrong, I think they did do right.
Yeah.
But what I'm trying to say is, this could happen every year.
Well, you hope not. I mean, this is a special case for you this year, wasn't it? I mean,
It's been going on for years, but
I mean,
this
you
is
know,
not
but
till like this year.
we at the clinic had somebody phone up had lost 7 youngsters. 3 days later, had lost over 30 old birds.
You know, let's hope this year is going to be a lesson to everybody who's going overseas. That's all you can do, is ask people to, you know, reflect on what's gone on and say, well, look, you know, we don't want this problem next year. We don't want to get to racing and have the same sort of problem. So I hope from what's gone on this year, people are going to learn something, going to be a lot more vigilant and worry about what they're bringing into the country. and that's all we can do. I mean, you know, it is going to be discussed further through the year as we get through the year to see what can be done, but I mean, that's for the future. But we would hope everybody learns something from this. Yes, Stuart.
The weekend of the ban really opened a few people's eyes. On the Saturday and Sunday, you can imagine my phone was relatively hot. I'll just relay a couple of the phone calls that I had. Both the people that rang me up were Welsh fanciers, I could tell by their accent. And the first phone call I had, the guy ranted at me for 5 minutes. You know. And when I got him to finally calm down, I said, well, how would you feel if you put your pigeons in a basket on a transporter alongside somebody else's birds that have Paramyxo? And his exact words were to me, well, I don't really care because I don't vaccinate my pigeons. And that happened twice. Okay. The other thing is that you gents have turned up today. I probably guess that 100% of you guys do vaccinate your pigeons. But I guarantee you, people in this room will know people who don't. And they will also know people that borrow other people's vaccination certificates. Make no bones about it, pigeon racing also has people that abuse the rules as well. Yeah. And unfortunately, you know, the decision that Colin made firstly and we followed on, we had to do something because we didn't know what we were dealing with at the time.
Yeah, but like I say, at the end of the day, I'm not going to worry about anybody else because I know my pigeons are vaccinated. Good. Right? But what I'm trying to say is that there's 89–90% here that are vaccinated, but we've got stopped flying because there's somebody that brought pigeons in that weren't vaccinated. That's all I'm saying.
Or did the people know that he wasn't vaccinated when they should have been vaccinated?
Well, they should have known that they were.
Yeah, that's right. Well, you have the paperwork for that, but obviously you
should have asked the question.
Well, again, you know,
Colin,
yeah.
The answer to this is that the only way you're going to actually restrict anybody in the future from doing it is if we bring in a rule at the next AGM, which would actually penalise anybody who's found to be irresponsible enough to carry out this practice. And then we as a union can actually take that forward. But you can only do that at the AGM and put it into the rules.
Yeah, yes, he's been waiting at the back there for about half hour.
Well, but first of all, the iodine and the
Come on, boys.
And the Lugo is not an amino acid. It is just a disinfectant, and the iodine is believed to help a little bit in activating the metabolism, but it's absolutely not an amino acid. Amino acids are broken down proteins, the basic stones of proteins that are amino acids. A whole lot of them, but iodine is not an amino acid.
No amino acid in iodine?
No.
Thank you.
No. Okay.
No.
Or you just keep it a secret.
Paramyxo is a notifiable disease. Anybody who's got Paramyxo in the loft must notify DEFRA. And DEFRA keep in touch with the union as to what's going on anyway, so we would know anyway. And you know what the pigeon fraternity's like. If somebody's got something in their loft, somebody will know about it. Somebody will know about it.
Well, I've got one close to me, and I knew nothing about it until somebody from another club told me.
But it's the same with all these things, isn't it? You know, unfortunately, pigeon fanciers by nature are secretive anyway.
Well, there have been reports of Paramyxo in other birds. Yes, there have. Also, even in parakeets, parakeets that the twisted necks, and also in wild birds. And also, of course, in wild pigeons. Yes, of course. However, you will not often see them because they will be a prey for the raptors in a short time. So you will hardly ever see them. But they are. Yes, it happens. It happens. if it's treated and cured, and even if it has a twisted neck, so they are perfectly for breeding, perfectly.
Same as paratyphoid? On the wing?
Paratyphoid, you have more problem. You may have more problems that may come back. When the bird has had Paramyxo, it will not come back because he will have a very strong, from the natural infection, viral infections give a higher immunity than bacterial infections. Salmonella doesn't give a good immunity. Pox gives a very good immunity. If a pigeon has had pox, wild pox, natural pox, they never get pox again. The vaccination does not give such a high immunity. And viral infections like pox and Paramyxo give higher immunity levels than bacterial infections like Salmonella.
It don't take none of the goodness from the pigeon?
Absolutely not, no. My colleague, Dr. Smith.
Could I just bring to attention, Colin said rightly that Paramyxo is a notifiable disease. That means it's in the same category as things like foot and mouth. So it is classed as a very, very serious condition. You don't have to have it confirmed in your lot. If you suspect you've got it, you are supposed to tell someone, like definitely, or at least take advice. You don't have to have it actually confirmed in your lot before you're supposed to do something about it. There we are. Arnold? That is what the law says.
Yeah.
Well, I know anything. I know something else. I know that in many pigeons, in very healthy pigeons, winning pigeons, you can find anything you like. In any winning pigeon, you can find E. coli, streptococcus, staphylococcus, mycoplasma, chlamydia in any pigeon. A result from a lab doesn't mean anything to me. Nothing. 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 I need to see the pigeon and report. And I don't want to tell you how many false, positive results I've seen. Completely crazy. Reports from a lab, find this and this and this. The vet doesn't know. He's a very good vet in reading, so he thinks this is my problem. But the problem is completely another problem. A complete other problem. So these results never make me nervous.
Have you ever treated pigeons with streptococcus?
Yeah, of course. Many times you find a swab, but...
What symptoms do they get?
Yeah, but...
You've experienced it?
No, but streptococcus is not a disease in pigeons. That is a mistake. That is a mistake.
It's from cattle it is, originally.
Sorry?
Streptococcus bovis.
In cows. Bovis is cow.
Yeah.
In pigeons, streptococcus is not a typical specific disease. You can have a streptococcus in your throat, in your intestine, and some idiots say in your muscle, and then you give a streptococcus infection all the birds that fly oblique in the spring. That's completely crazy. I've seen in 30 years 2 cases. This has been a result from the University of Ghent, a report, a study. But studies never talk about incidences, how many times that happens. If that happens 1 time in 500 years, it's a very important, interesting story, but it doesn't mean anything to our sport. I have seen many pigeons who cannot fly anymore after the race, and I have 1 time seen in 40 years streptococcus. This pigeon, a muscle infection, only 1 time. And all the cases I've seen is injuries from the shoulder, ligaments, muscles, mostly ligaments. And that's, of course, if you think about it, just logic. If you do top sport, we as humans, we have many problems with our articles.
What would you treat a pigeon with streptococcus?
I would not treat it at all. If the pigeon is sick, I would. If it has ornithose, and I think that it is triggered by, not by mycoplasma, but maybe by streptococcus, I would treat it. But streptococcus, yeah, we can fight streptococcus. But it's not a big problem, I think. Yeah, that's right.
Anybody else? No? Right.
Great.
You want to sum up then, David?
I'm surprised anybody hasn't asked about respiratory, because respiratory is possibly one of the worst things that we suffer as pigeon fanciers, whether you realise it or not. I don't want to pick up on it.
I will tell you one thing. upper respiratory, you have the respiratory system, you have the upper respiratory, middle, and deep. And the deep respiratory is lungs and air sacs. The middle is the trachea and the bronchium. And the upper respiratory is eyes, nose, sinuses, ears. The main problem, the biggest problem with pigeon sport is not Paramyxo, not paratyphoid, it's ornithos. And they are not sick, but they don't fly. They just don't fly. And they are not sick. It is small problems here, and that is the main reason that your birds, after 4 or 5 races, the condition drops dramatically. They come back home tired, the breast muscle is blue, the ears are standing off, the feathers are dry, they don't train, they don't bath. That is all upper respiratory problem. That's the biggest problem in our racing pigeons. Mostly due to very bad lofts, too drafty, too open, too cold, etc. That's the problem. That's the problem. They don't die, they don't get really sick, but they don't fly anything anymore. You start fantastic, 50%, 40% price, birds coming on the chain, and every week going down. Then in the end, the birds come 5 minutes late, all one after each other. They sit on the loft, picking in the feathers, scratching the head, ears like this, dry feathers, no powder on the bath, no bathing, no powder on the water. Droppings are normal, blue, and that is no down feather fall, very important, no down feather fall. That is upper respiratory problems. That is the biggest problem in the race season for your old birds and for your young birds. Always, when the people come to me, we treat those pigeons, and most of the time it goes well. But when they come back after 2 weeks again, we always ask, bring pictures from your loft, make a drawing, like a cut through of the loft. And most of the times, by changing the loft, we can solve a lot of these kinds of problems, because many times there is a cold airstream from top falling down on the pigeons, like a kind of air conditioning. And that is very, very, very bad for the pigeons, absolutely. It's terrible. The pigeon loft must be like a room with no draft and nice. If I sit here and I open a window there and a window here, and tomorrow I catch a cold, because we all have the virus. The air has no virus. We have viruses in our body. We have everything in our body. It just doesn't come out. It comes only out under bad circumstances. If you put 500 soldiers together in a very small room, after 2 weeks, they got all kinds of diseases coming out. And if you don't put them together, disease will not come out. It's a matter of infection pressure. They get, and the pigeons is exactly the same. That's the story. So be aware of that. If your birds, after 4 or 5 weeks, go down in condition, 90% it is respiratory problems, and for 80% it's due to the loft, which is sometimes good, and some weather conditions is good, and in some weather conditions it's not good. And don't make your loft like an open aviary. An open aviary is also okay, because in an open aviary, that's what the people always say to me, and HenK, in an open aviary, I say yes, open aviary, but in an open aviary there is no cold airstream, not a difference from 1 degree in temperature. That's completely different, that is open. But if you sit inside on a stream, a draft of cold air, then you get ornithos, upper respiratory problems. And not that the birds are sneezing, sometimes a little bit, not that they are rattling, not they have dirty noses, no, just a little bit. The symptoms, as I told you, dry feathers, no down feather fall, blue breast meat, no powder on the wings, etc., etc., etc. Very big problem, and mostly more in cocks than in hens, because the cocks are fighting in the crates. They are fighting. Many of the widowhood cocks are already beaten before they have been out for 1 minute. Already beaten in the crates. Already had like this because respiratory problems. Okay, that's what I want to say about respiratory. That's very important.
I close my aviaries up at night. I keep my hens in an aviary on a roundabout system. Now I got doors to shut off the aviary completely. So So that's bad to do that. I should keep the apiary open right through the night as well.
Well, it depends. If there is no open aviary on one side, it's also perfect. If this is a pigeon loft here, this small thing, let this be a pigeon loft. Completely closed, like a shoe. My father always said, a shoebox. And then you have only in the front side, like here, for instance. And then you put the mosquito wire in. That's perfect, because the wind comes in and out, and there is no draft through. My father used to say, people said, the oxygen, not enough oxygen. He always used to say, I remember, my good old father, he said, oh, don't be afraid, you can keep 5 elephants. They will not die of lack of oxygen. So, you see more trouble with too much air than less air. And also when I go to China and to Taiwan, it's open, open, open. And all these pigeons have respiratory problems. They look many times. They buy the best pigeons in the world. They buy pigeons for a quarter million. But when I see the lofts, it's terrible. They need to learn a lot, because the condition of those pigeons is terrible, terrible.
That's interesting.
Yes, good question. No, I cannot give an answer, because I think there is many difference in transporters and in systems. So in generally, I cannot, no, I don't know. No, I really don't know. I must see it, I must feel it, and then I can say something about it for what it's worth. But in lofts, I have made a lot of recommendations for pigeon fanciers. Even by telephone, even by drawings, even by sending me pictures from the loft. And many times, without antibiotics, we could help the people a lot. And they told me after changing the loft, 2 weeks later, birds were more smooth, the necks were smooth, the ears were flat, powder on the wings, down feathers every night, 4 or 5, very important. A lot of improvement without any treatment, even just by changing the loft.
Anything else?
Any more questions?
Okay.
No?
I think actually Henk said there, something very important. He's cured a lot of people's problems by the loft. And the draft thing, I hope you all understand that. It's very important, very important. We were in Newcastle, we saw 40 fancies, and half the fancies got a wrong design loft, Henk, yes?
Yeah, the terrible condition.
Terrible
Condition. If the people ask me, how is my loft? Is my loft good? I say, show me your pigeon, show me your pigeon. I can see on a pigeon if the loft is good. If the birds look terrible, the loft is terrible. If the birds look splendido, the loft is perfect. It's so easy, it's very easy.
Gentleman over there, did you want to ask questions then?
If everybody else have finished,
Yes?
I would like to thank
Is everybody done?
on behalf of the Welsh Union. I'd like to thank you for coming.
I'm sure he wants to thank you. Well, Henk is, I'd obviously just elaborate on that and just sort of say that Henk's a very busy guy, really busy. He's a pigeon fancier just like us, but he doesn't see his pigeons very often. He spends time with people like us.
I'm flying more than a pigeon. I'm flying more than a pigeon.
But he finds it, he's out and out pigeon man, as I said to you earlier, and I hope you've all enjoyed this evening. It's just a short insight into a few ideas, and he's a very, very interesting man to talk to.
Yeah.
Right, there we are. Thank you, young man. That's all right. No, I'd like you to put your hands together.
Thank you.
And I'm sure if there's an odd question just before he leaves tonight, anybody wants to ask him personally down here, I'm sure he'll answer for you.
Did anything for peregrines?
Thanks for all attending anyway and giving good order through the evening.
Ladies and gentlemen, I thank you very much for your attention. You were a great audience. It was so quiet I could even hear it. Pin falling. Fantastic. I love doing this, especially with nice people like all you here. Thursday I will be in Cairo in Egypt for a big audience. I never knew, but they have many fences in Egypt, but also interesting, I think. So thank you very much for coming, for your good questions, and whenever you have a problem, don't hesitate to call us, because we always try to solve your problems to the best of our knowledge. Thank you.
very, very much. Thank you.
Just before you leave, you will notice that on the right there, there's a camera been whirring away